Here at Big Sky Dental with Dr. Knable in the chair. I need one of these in my house. These are beautiful. But when the kids come in, you get a lot of kids coming in and you look inside and you think, well, there's a problem here. Maybe they're not brushing just right. And what do you tell the parents?
I always ask the parents if they're brushing for their kids still. And that's a very important question because I believe that they should be at least up until the age of around 5.
So sometimes the parents are stopping when they're 1 or 2 and you say, hey,
yeah.
no, you shouldn't be doing that.
Definitely. What I find where we have the problem is when parents will stop brushing too early, and they think, oh yeah, my kids, I tell them to go brush, and they brush magically and they're clean, but it's not well enough, and so we find problems then.
So you bring the kids in, but then you have a chat with the parents then, right?
Oh, definitely. Most of the time when I have the kid in the chair, I'm talking with the parents. I mean, the kid's having fun too, but I'm getting the information from the parents.
And you sit down. Is it tough for the parents to figure out, how to brush their kids' teeth? Do you teach them that a little bit?
Usually it doesn't go too bad because they're brushing themselves pretty well, and actually it's easier for them to brush their kids' teeth because they can see what's going on rather than trying to do it on themselves. So it's not too bad.
So Doc, what is it? Why are the kids having trouble? Is it trouble with actually getting their hands inside their mouth and doing a good job of brushing?
Absolutely. They don't have the dexterity to do it correctly or well enough. So I always recommend parents brush their kids' teeth till about 21 years of age. I always talk with the parents and see what they're doing with their child and see if it's appropriate and going to work for them or not. We always ask them if they're brushing their kids' teeth enough.
So other than brushing the kids' teeth, some other procedures that you have in the office as preventative care for kids?
Yeah, we have a great preventative procedure that's called sealants, and it lets us basically seal the kids' teeth in the back, their grooves, so they don't have the chance of getting cavities in those areas. So that really helps out in areas that we think may be having a problem.
Is the sealant a no-pain procedure, and how long does something like that last?
Oh, absolutely. The sealants, they do break out if the kids aren't taking care of them, so if they're eating ice or, hard candies, whatever, they can break them up because they're not, prepped into the tooth. They're just glued onto the surface. But they do last a long time if they take care of them.